Hey besties, welcome to Get Fit in Your 40s, where we get real about our own journeys and how we have helped thousands of women figure out why what worked in their 20s isn't cutting it anymore.
We are your hosts, Duki and Kausar, your fitness BFFs, here to help you navigate losing weight and getting healthier in your 40s and beyond. Let's get into it.
Welcome back to another episode of Get Fit in Your 40s, the podcast where we talk about all the real and sustainable ways to lose weight for women over 40, especially if you're someone who's struggling with hormonal shifts and wondering why what worked for you in your 20s is no longer working. I'm your host, Kausar, certified nutrition coach and the founder of BFF. Before we get into this juicy topic today with our special guest, I want to invite you to head on over to our website, bff.zone. We have opened enrollment for our new program, Fit in Your 40s. It's a 4-week weight loss program. Our clients not only lose 5 to 10 pounds, but they're able to balance their hormones and keep their weight off. So make sure to check out. Today, we're going to be diving into one of the hottest, most talked about topics in the weight loss industry, the GLP-1 medication or the weight loss medication, such as Ozempic, Wegovy, and Mounjaro. These drugs have been taken up a storm and people are seeing amazing results with that. GLP-1 stands for glucagon-like peptide. It's basically a hormone that your body actually produces. It helps with balancing insulin levels, curb your hunger, and balance your blood sugar. But with such fame, also comes a lot of confusion because a lot of women are trying this medication and they're seeing tremendous results. And so some of us are wondering, because we have spent years of research, years of working with women in the weight loss industry, trying to help them lose weight, navigating through hormonal shifts. And now they're seeing these results with the little pill. So we're going to dive deep into understanding why and how you can use this medication safely, what are the side effects, and how can women in their 40s take this medication safely. To help us with this topic, we have an expert. Our guest is Dr. Ehab Ibrahim. He is the president and founder of Advanced Medical Group. Dr. Ibrahim is a board-certified physician in internal medicine and a diplomat of the American Board of Obesity Medicine, bringing over 20 years of dedicated service to patients and their families throughout northern New Jersey in primary care and weight management. The coolest thing about today's interview is that he carved out time from his busy schedule to come. We were going to offer to do this virtually, but he was gracious enough to come on here in the studio. So if you are a visual learner like me, head on over to our YouTube so you could watch this episode live. Welcome, Dr. Ibrahim.
Thank you so much, Kausar. Thank you for the introduction. I appreciate you hosting me today. It's a pleasure.
No, thank you so much for coming. We're so excited to have you because this is literally one of the questions that I'm asked every single day on our social media platforms. Even our clients are curious to know. But before we go much deeper into this topic, I would like to know a little bit about you. How did you enter this field of weight management?
So after graduating residency from NASA University Medical Center in 2004, I started my primary care practice. One of the most interesting things I noticed was a lot of these diseases and conditions that we are managing are related to obesity. And I started really helping a lot of patients with their weight goals. And that actually led to an amazing results. So there is a lot of conditions like diabetes, high blood pressure, high cholesterol, arthritis, and many more were improving just by getting the patients to an ideal weight goal. So that's got me very excited. It was very rewarding. My patients were achieving their goals in a very healthy way and were able to use less and less medication doing this. So I wanted to advance more my education and experience. I enrolled in obesity medicine and I got certified with obesity medicine. And throughout these years, I've been managing hundreds and thousands of patients with medical weight loss.
That is incredible. You got inspired because just by losing weight, you were seeing your patients see results. That's exactly what I see in my career. We've been doing this for almost 10 years, and I've seen my clients reverse diabetes. Literally, we had a client who wasn't able to get pregnant. She lost 35 pounds, and then she naturally became pregnant.
Correct.
It's pretty profound.
Unfortunately, obesity has been booming in the last 20, 25 years in the US.
Yes.
Over 40% of Americans are considered obese.
Oh my gosh.
That means BMI 30 or more. We have another 30% of Americans considered overweight with BMI 27 or more. So if you add that up, that's over 70% of Americans either overweight or obese. And that's a very, very high number, and it's very alarming. Obviously, there is a lot of factors that lead to this obesity and overweight in the US. But everyone was trying to work together, trying to reverse these numbers, because we became one of the most obese nations in the world.
Wow. So you are saying that weight loss medication was a miracle for Americans?
So the weight loss medication, when they were first introduced a long time ago, they were helping a lot of patients to achieve their goal and helping them through a healthy life to get where they want to. But in the last few years, after the introduction of the GLP-1, that became a powerful tool that we'll be able to use and help the loss. Again, there is no miracles. It's still the patient, they have to understand that there is a lot of work that needs to be done on their behalf in order to achieve these goals.
So let's go back to basics. What exactly is GLP-1 medication and how does it work in our body?
Sure. So the GLP-1 medication were investigated in the mid-80s and the 90s. The first medication was introduced to the market in 2005. Since 2005 until now, there was a lot of developments. They made these medications more convenient, less side effects, and more effective in weight loss. The way this medication worked, basically the GLP-1 agonist, in other words, they go to the receptor of the GLP-1 enzyme, which is naturally secreted by the body. So they go to the receptor, and by simulating the same action of the enzyme, that will cause many effects. For example, increasing the insulin when it's needed will lead to lowering the blood sugar. Two is the lower the motility or the stomach emptying time, so the food sits longer in the stomach. We do also have other effects on the brain where they suppress the appetite center, causing less hunger and less craving. And recently we have more benefits this medication where they help the heart and the blood vessels. So that's actually having more cardiovascular benefits, causing lower blood pressure, and even improving cholesterol as well.
Oh, wow. So it is basically, we all produce GLP-1, right? It's a natural hormone that every human being produces. And so when you call it the receptor agonist, that means it's mimicking.
It's mimicking, yes.
That's great.
That was actually the first generation, the GLP-1, and now we have a newer generation, which we call the dual peptide or the double peptide, because they not only work on the GLP-1, they work on another enzyme called GIP. And this is the medication tirzepatide, marketed under the name of Mounjaro and Zepbound. So obviously, when we have this new medication that works on both enzymes, we have a better result, we have less side effects, we have more convenience administering this medication as well.
That's a huge innovation. Who do you think is a good candidate for this medication?
The guidelines outlines the candidates as anyone with obesity, which is BMI 30 or more, or any individual overweight with BMI 27 or more with at least one medical condition like diabetes, high blood pressure, high cholesterol, or sleep apnea. Just to sum it up, either 30 or more or 27 or more plus one medical condition.
Okay, so the medical condition has to be one of the criteria, because now I'm seeing celebrities on this medication. It's pretty abused, I feel.
When we talk about the guidelines, these are basically the rules or something to guide us prescribing this medication. But of course, there is off-label use. I've seen people, their BMI is 23 and 24, and they're coming to the practice and they're asking for this medication. It's not really the proper practice. But we should really, just for 30 or more, even if they don't have a medical condition, they are eligible to be on this medication or a candidate to be on this medication. If they are 27 or more and they have at least one medical condition, then they are a good candidate for it.
So how effective are GLP-1 medication for long-term use? Is there like a guideline on how long you can use this medication?
That's a very important question. They are approved for long-term use because, again, like I mentioned before, this medication, they've been around since 2005, and there is patients who are on this medication for almost 20 years now.
Wow.
So they are approved for long-term. But it's very important if we're talking about the weight management here. We're not going to talk about diabetes. The weight management is the patient also has to be aware of this, the effect of this medication and how they work, and not totally depend on the medication. They still have to work on their lifestyle, on their nutrition, on their exercise in order to achieve long-term results.
So that's a very good point, right? When my clients come to me and ask, what are your thoughts about medication? I always guide them onto, okay, so we have to make some of the lifelong changes in habits before you tap into medication. Or maybe you start medication and make lifestyle changes. What are your suggestions on how to make the necessary changes in order to lose weight? And how does it play out? For example, if someone's going on medication for 3 months and they're pretty awful eating habits, what's going to happen when they get off the medication?
So I always like to use this analogy of when I have a patient and trying to get from point A to point, which is the weight they are at right now, and their goal weight, is if the patient is a driver. They always need guidance, like a GPS. Yeah. That guidance is basically the right nutrition, the right exercise, the right healthy lifestyle, including sleeping well, stress, and everything. And that's when we use experts like yourself and Doki to guide the patient through this process. Now, you need an engine for this car in order for the driver to get from point A and B. And the engine are this medication, because it really enables the patient to control their appetite, to control their craving. They are more in control to what they are really consuming food-wise.
Women over the age of 35, when we are entering the gates of perimenopause, if you have those crazy cravings, it's not your willpower. It is a chemical imbalance in your body. That's the drop in estrogen and progesterone that causes you to have those insane cravings. What are the things that you suggest for women to know before starting the GLP-1 medication, especially if they're insulin resistant due to the drop in the estrogen? What do you suggest?
So the first thing is to get a basic comprehensive metabolic and hormonal panel that includes hormones like the sex hormones, sugar, insulin, thyroid function, cortisol level, and also vitamins B12, folic acid, and vitamin D. Second thing is it's important to stabilize their blood sugar, and that can happen through consuming less carbohydrate, more proteins, exercise. Another factor is they need also to balance their hormones, and that can be done through cutting down stress, getting enough sleep, and staying away from processed food. And the last thing is, of course, all this means they fail, and then the resorting to medication, that doesn't mean that there is something wrong with the patient. No, it's absolutely fine. You're just asking for extra help, which we all need sometimes.
And we mentioned before, when you have those hormonal shifts and those crazy cravings, it is not your fault. Okay? Having that medication can actually help with those cravings. So going back to your point, if you are a woman considering GLP-1 medication and you're in perimenopause, you are a good candidate?
Before considering the medication, which I always advise patients to not jump into medication right away. It's like any other medical condition. It's not always the easy solution. It's not the magic key to all our problems. The first thing you have to do a concerted effort first on your behalf, trying to live your life the healthiest you can be, which again, like we mentioned before, about balancing your diet, about exercising, about sleep, about cutting the stress. That's before you consider medication. Another thing also, before even you go into this medication, which should be done by your healthcare provider, is checking certain hormones and metabolic panels to make sure there is nothing wrong with your hormones that's causing this problem. For example, sometimes we have patients that we check their thyroid and we find out they have underactive thyroid causing the weight gain and causing many other problems. And by just simply treating this condition, we were able to get them to help them lose weight and achieve healthy weight.
So like the first step is not to jump on the medication, not to jump on the trend. I honestly feel like it's becoming a business or a trend because now I see ads popping on my page on Instagram. Unfortunately, in this country, whatever hype anything gets, it becomes a form of business and money for whatever reason. So all my besties, friends out there, clients out there, make sure that, as our doctor mentioned, before getting into the wagon with the whole GLP-1 medication and ordering supplies, you have to do the internal check. Make sure that you are doing your walks, you are eating your protein, you are eating your fiber. And I'm sure if you're listening to this, you are following us on Instagram and you see how much we advocate for all of those things before you start the medication. Again, talking hormones, what if a client is on HRT? They're doing hormonal replacement therapy. They're getting patches for estrogen and progesterone or testosterone. Can they still be a good candidate for GLP-1?
Absolutely, yeah. There is no interaction between the GLP-1 medication and the hormone replacement therapy. They're absolutely fine if both are being administered at the same time.
Can lifestyle alone help achieve similar benefits, or are medication necessary if you are an obese person?
Lifestyle is the most important thing.
Correct.
And even when we use this medication, we're using some medication to enable the patient and help them, given this extra boost to achieve a healthy lifestyle. There is no medicine where patients can eat whatever they want and they don't exercise and they take the medicine that the fat is melting away and everybody looks like a celebrity. No, it doesn't exist. This medication, it's one of the elements that or one of the tools that help the patient follow a healthy lifestyle. I had a lot of patients come to see me for the first time and I asked, have you tried a serious a concerted effort to lose weight on your own? And I just go down the list with them. And a lot of them actually they were not aware that by changing their lifestyle, they can achieve the same goals. I don't start from the first visit unless I make sure that the patient already have tried enough on their own and then now they need this help. But many times I ask the patient, give them some guidance about diet, about lifestyle, and ask them to come back in a couple of months, and then we'll see what the result is. And a lot of times they surprise me. They do very well on their own.
Wow, that is so powerful. Okay, so I have seen both. I've seen people go into the medication wagon and they're still eating Burger King, McDonald's. They're pretty sedentary. They got the medication because, again, the doctor prescribed because they have diabetes. But then I don't see the lifestyle changes. And then I've also seen clients that I work with, and it's pretty heartbreaking. And I know if you are watching or listening to this, you can relate. You are working so hard. You're doing your workouts, you're doing your walks, you're eating your fiber, you're tracking your macros, you're lifting weights 4 times a week, you're doing everything BFF is telling you, and literally nothing is happening. And again, it's not to blame your body, not to shame yourself, not to have that negative mindset, but more of, okay, your body is changing. You're in perimenopause. Your body's going through these hormonal changes and that weight loss becomes really hard.
Correct. And that's why we see a very wide range of results with the patients because it depends how much they adhere to the lifestyle. That's the key point here. Again, there's patients who pretty much lose nothing. I have patients, you won't believe it, they actually gain weight while they are on this medication. And then I have patients who lose weight, but it's unhealthy weight loss because they lose muscle. My best patients always are the ones who really adhere to the plan, who use the guidance like your group. And with the help of the medication, they are able to change their life. They change their life 180 degrees. They are exercising, so they lose fat, they keep the muscle. They feel much, much better than before.
Wow. So guys, if you think that just by taking medication, it's not like Tylenol and it's going to fix your headache, there's a lot that goes into it. Your lifestyle, your mindset. First thing first, we always talk about mindset. You have to understand that if I'm making this shift, medicine is just a little patch. It's going to help you get to that next level, but it's not going to do all the work for you. So you have to make some necessary changes in your lifestyle.
Absolutely, I agree 100%.
Great. So what are some of the criteria you must meet in order to be eligible for this medication?
So we start with the age of 12 and older. The other criteria is the body mass index, which is basically, it's a calculation, takes in consideration the weight and the height. For BMI of 30 or more, they are eligible, or as I mentioned before, 27 or more plus, they have to have another medical condition, for example, high blood pressure, diabetes, high cholesterol, sleep apnea, then they are a candidate to be on this medication.
And that's correct for women over 40?
It applies for everyone, yes, including women over 40.
So the thing with body mass index, what if you're a bodybuilder and your body mass index is off the charts because you carry so much muscle mass?
Correct. Yeah, that's always an interesting point because BMI we use it a lot because it's basically just very easy to use.
Convenient.
It's easy to get the height and the weight and we have a number. But if we are talking about like a more accurate and more reliable method, and then we have to check the fat muscle ratio in the body. And that can be a little bit challenging because the best way to do it is through the bone density or the DEXA scan.
DEXA scan.
Yeah. The insurance is not going to pay for it if you are doing this just to check for how much, your body fat percentage. And then that's something range between $150 to $300. Not everyone can afford this. And then obviously once you start losing weight, you need to repeat this and monitor. I'm not sure if people are willing every couple of months or every 6 months they're willing to pay this amount of money just to check their fat percentage. There is other methods like the bioimpedance scales. They are not as accurate as the bone density, but we can use that. We use it in the office for these patients who are, like you mentioned yourself, who are not really sure this weight because of belly fat or muscle. The reality is patients with a high BMI, if someone really BMI is 36, 37, definitely there is enough fat here to lose. But I get your point about patients who are like borderline, that like their BMI is 30, 31, 32, or is it really much? Is it fat? Is it muscle? And that's become sometimes challenging.
So the area where we work, which is women over 40, and I see one of the biggest struggle they have is taking in enough protein.
Correct.
If you're not eating enough protein and you're not lifting weights, you're not building muscle mass. And guys, we talk about this all the time. You are sarcopenic. After the age of 35, you're losing a lot of muscle mass. Lifting weights and eating 1 gram of protein per body weight, that's necessary. That's non-negotiable. And I know for a fact, I struggle with taking in a lot of proteins. So if we're not doing all those necessary steps, does that mean that medication is actually making you lose muscle mass rather than body fat?
Naturally, all humans will start losing muscle mass from the age 30.
Yes.
It's about 3 to 8% of total body muscle every decade. By the age of 70, most of the people do lose between 15 to 30 of their muscle mass by that age. And there is a wide range here, as you notice, 15 to 30, and it depends on the lifestyle, depends on the genetics, depends on their exercise, depends on their nutrition. So if we're focusing about women over 40, of course, with the hormonal changes and the menopause period, there is accelerated loss of muscle mass.
Yes.
That's why one of the very important elements we focus on when the patient goes through the journey for the weight loss is strength exercise and eating enough protein, because that's the key here to maintain and actually grow muscle mass. And that's a very common complaint I get from patients who like, I'm 40, 50 pounds lighter. I look great, but the problem is I'm feeling weak. And the first question I ask them is how much exercise you do. For the most part, the patients, they just, no, I don't exercise. I'm just happy. I'm the scale, the numbers are coming down. But I tell them, no, my goal is not just weight loss. My goal is to get you to healthy. We're not treating the number. I want you to be healthy. That's a very important question you asked about muscle mass. It's not just seeing the number drop. It's just dropping in a healthy way.
Did you guys hear that? Muscle mass is your key to longevity. If you want to live longer, you need to have muscle mass. That's going to support your joints, because at some point you're going to fall and get injured. That's why we have so many injuries after the age of 60, 70. And the repair is even harder. So if you are considering medication and you haven't really tackled how to build proper muscle, and we're talking muscle building, not just holding a little 5-pound dumbbell and going for a walk. We're talking proper hypertrophy, which means you have to do a proper strength training plan 3 days a week, upper body, lower body, and full body, something like that. So what are the side effects and how long are we going to need to be on these medications to see results?
Okay, that's a very interesting question. I want to make it clear from the beginning. Everything in life, not just medication, there is a possible side effect. When we go swimming, there is a possible side effect. When we go driving our car and go to the supermarket, there is a possible side effect. This medication, obviously, they come with this possible side effect. And I'm going to mention first what are the common ones, and then the other side effects that's less common. So the common ones, because they work on the stomach, so we expect some nausea, some heartburn, some abdominal discomfort. Some patients they complain of constipation, sometimes diarrhea. These side effects are usually, even if they happen, most of the time they are mild, and the patients, as when they stay on the medication longer, they get used to the medication and they experience less side effects. A couple of more side effects, we see them less common. One of them is pancreatitis, which is inflammation of the pancreas. Luckily, it's not really common, and in my practice, I have seen just a handful of patients that they have experienced this, and it was never severe enough that require admission. Just by stopping the medication, they were able to get their pancreas back to normal. Another side effect is gallbladder disease and gallbladder stones, which does not only happen with the GLP-1 medication, but happens with the sudden weight loss. There is a black box warning for this medication. It's important to clarify why there is a black box warning, and that's regarding thyroid cancer. And there was increased incidence of thyroid cancer during the studies in animal studies in rats. That kind of thyroid cancer is called medullary thyroid cancer. And in humans so far, since we start using this medication in the last 2 decades, we haven't seen really increased incidence of the thyroid cancer. But because it happened in the animal studies, the FDA required the black box warning on all the GLP-1 medication. And that's also another important point. Before we start this medication, we'll make sure there is no family of this certain thyroid cancer. There is another condition called MEN, or multiple endocrine neoplasm, which again, if the patient they have this condition or a close family member, we cannot start this medication because of the risk, just to be overly cautious with that.
And how long do patients need to be on the weight loss medication to see results, and then they can stop?
So this question has 2 parts. How long before they see results? And that's very variable from one patient to another. There is patients who start losing weight right away from the first month, and there is some patients take them a couple of months and until they get to a higher dose of the medication to see the full effect of the medication. It also depends on the patient, how motivated they are, how much effort, how much they are aware of the change in the lifestyle, and how serious they're going to take this journey. The second part is how long they need to be on it. What we do in practice is initially start titrating the patient from the lower dose and go to the most tolerated dose with the medication. Once we get to the goal weight with the patient, we start tapering off this medication. Sometimes we space them out more. Instead of injection once a week, we can make it every 10 days or 2 weeks. And we see how it works. Some patients are successful enough to get over the medication because right now they are very motivated. They see the weight loss, they see how healthy they are. They adapted this lifestyle. The reality is this is about 20 to 25% of the patients. But the majority of the patients, they still need this medication on the long term, which is absolutely fine. If we can give them a small dose, like I mentioned, or at a longer interval, that's okay. And it's not something harmful because the way we look at obesity and overweight right now is different from before. It's like a chronic condition now. This is not it's not like it's common cold. You get some medication over the counter, a couple of days, and then you are done. This is a lifetime struggle. And being on a low dose medication for long term, that's absolutely acceptable as long as they are being monitored by a healthcare professional and make sure there's no side effects or complication from this medication.
And once they get off with no necessary lifestyle changes, the whole thing could be reversed, right?
Absolutely. Why I mentioned before, it's not the ultimate
magic pill.
Magic pill or the magic injection, that we are dreaming of. Oh my God, I get this injection. I eat everything I want and I'm not going to exercise and I'm going to get amazing results. No, it's not going to happen. Again, I can't stress enough, it's the lifestyle is the most important thing. And when we use this medication, it's something to help you to achieve this healthy lifestyle. It's not to replace this lifestyle. You have to pick the right provider. You have to get someone who's really certified to do this kind of work. Your health is the most important thing, and you need to invest in it. And if you put your trust in someone, you really need to make sure they are the right person.
Yes, that's a great point. To close off this beautiful conversation and this podcast segment, what is the advice you would give to women over 40 who are struggling in their journey and they are considering weight loss medication?
My advice is do not jump on this medication right away. Other things that you can do first before considering the medication. First things you have to, as I mentioned before, you need to get comprehensive hormone and metabolic panel. Make sure that your hormones, your blood work, your sugar, your cortisol level, your vitamins are in check. Two is you need to stabilize your sugar level, and by lowering your carb intake, increasing the protein and exercising, that can help a lot. The important also is balancing your hormonal health. We talked about this by having more rest, by cutting down the stress, by living a healthy lifestyle. And if all this is not working, it's fine to find the right provider, whether a physician, nurse practitioner, or any provider, but someone who is trustworthy. You can start the medication because they need to make sure you are the right candidate for this medication and make sure there is no harmful effect. The first rule in medicine we always learn is do not harm. And that's why a lot of people are very cautious prescribing this medication, because we need to make sure we are the right candidate. We need to make sure you are in safe hands.
Has anyone tried to trick the system to get the medication? Do you see a lot of those cases?
Unfortunately, as you mentioned before, they are very popular now. They are the blockbuster in the market.
Yeah.
It's the easy solution. Everyone is talking about it. Yeah, so I get a lot of these patients who are trying, and I had a patient, her body mass index was 21, and she was coming for this medication. And I told her, it's very unethical for me to prescribe it to you. If you really need to do something about it because you are not happy with yourself, you need to focus more on nutrition, on increasing your exercise, on cutting down the processed food, and ended up not prescribing the medication for her. She wasn't happy, but I had to do what I
She
had to
just
do.
wanted to cut some body fat. Some of the celebrities are.
Some people didn't actually need to cut out the fat, they just need more to build the muscle.
Yes. What happens to the woman's skin? I know we care a lot about our skin.
Correct.
Is there any changes when they're on the GLP-1 medication?
Yeah, so I'm sure everyone heard about the Ozempic phase before. And that's when women, when they are on this medication, they start having more wrinkles, and we get a lot of complaints. In any weight loss, there is a chance of having wrinkles. But there is some steps that you can take to prevent or reduce the amount of skin wrinkles. One of them is you have to have a moderate weight loss. The sudden weight loss or the severe weight loss doesn't give the skin the chance to adjust to the new weight. Another thing people can do is drink a lot of fluids. Make sure you exercise, because building the muscles under the skin will be able to hold the skin and you avoid or reduce the wrinkles.
Right. So the final thoughts based on what our experts mentioned, plus what my expertise is that please be sure to focus on lifestyle changes. Before you jump on the wagon with medication, you have to do a little checklist. Have you been eating enough protein? How do you know how much protein you need? You take your goal weight, you multiply it by 1. That's the amount of grams you should be consuming per day. Are you exercising? Exercise is one thing, but lifting weights is another thing. You should really be focusing on lifting heavier every week. That's how you build muscles, and focusing on proper nutrition, walking, and stress management, like he mentioned. And then if none of this is working, you are welcome to explore the options with the professional, with the right type of practice. Thank you so much for accepting our invite and coming all the way here to attend us in person. We are so appreciative of you.
Thank you so much for hosting me today. It was a pleasure. I always love to talk about this topic. It's my passion to help patients lose weight and become healthier.
Please make sure to check out the show notes. I have put the link where you can find our expert doctor, and where we have also added a bunch of freebies for you to download and start your journey right away.
Thank you.